Hey everyone, I'm Jeff, and today I'm gonna explain how the distribution of pulmonary blood flow can vary by each zone of the lungs due to the effects of gravity and different pressures within the lungs. For example, ventilation and perfusion ratio is higher in zone 1, which is the apex of the lung, the top, when a person is standing than it is in zone 3, which is the base of the lungs, because perfusion is nearly absent. However, ventilation and perfusion are highest in the base of the lung, resulting in a comparatively lower ventilation perfusion ratio. Also, I want to talk a little about Poiseuille's law and how it pertains to blood flow, and briefly describe cardiac output and pulmonary vascular resistance. Secondly, I want to explain ARDS, or acute respiratory distress syndrome, and how this has become a very major issue over the years with an increasing mortality rate. I'll explain more in depth of that a little bit later, and how ARDS can alter one's lungs, certain criteria to be diagnosed with ARDS, and also management of ARDS, along with a few other topics pertaining to ARDS. Lastly, I want to give it an in-depth look into prone positioning and how this may or may not be beneficial to patients with ARDS when all other measures and resources have not quite been fully successful, or not very much improvement has been seen from the patient. I'll show some chest x-rays and some CT scans of patients that had significant improvement while being in a prone position using a rotoprone bed to help better oxygenate them and improve their overall health. There are a few contraindications to be aware of before seeking this option, but I'll touch more a little bit on that later.